The Societal Impact of Pain, SIP, is an international platform created in 2010 as a joint initiative of European Pain Federation and pharmaceutical company Grünenthal, and aims to raise awareness of the relevance of the impact that pain has on our societies, health and economic systems, exchange information and share best practices across all member states of the European Union, develop and foster European-wide policy strategies and activities for an improved pain care in Europe. Pain policy. The platform provides opportunities for discussion for healthcare professionals, pain advocacy groups, politicians, insurers, representatives of health authorities, regulators and budget holders. 1 in 5 Europeans suffer from chronic pain, which results in immense hardship for them and their families. The knock-on effects for overstretched health services and the European economy due to lost working days is the equivalent of up to 2% of GDP on average, some €240 billion each year. This week, patient representatives, medical experts and other stakeholders from the Societal Impact of Pain platform met at the European Parliament. Their message to EU lawmakers: act now to address the pain crisis. EU Reporter spoke to Marian Nicholson of the Pain Alliance Europe, Professor Bart Morlion of the European Pain Federation and Marian Harkin, MEP. Marian Nicholson of Pain Alliance Europe. A great deal of talk in the European Parliament today concerning pain and the issue of pain. Why is societal pain such a pressing issue?
Chronic pain is an important issue not just for the individual but for the economies across Europe. So we're trying to encourage the European Commission to have a look at chronic pain in the context for them of the GDP. For instance, in Sweden, 10% of GDP is expended by costs of chronic pain, both medical and societal. And across Europe widely, it's more like 2% of GDP. Then, from an individual point of view, people are happier and healthier if they're at work, and therefore encouraging health services and ministries of social security to encourage systems that allow people to go back to work is really beneficial for the people and for society and for communities and for economics. So, for instance, early diagnosis, getting appropriate treatment really early on. If it's 6 months before you're referred to a pain specialist, pain can become chronic. And once the pain is chronic, treating it is more difficult, more costly. The chance of your getting back to work is lower. And indeed, many people do become, the phrase is, involuntarily retired due to chronic pain. And then, with an aging population across Europe, it's quite important that older people, who are indeed more likely to have chronic pain, should be allowed by appropriate treatment and rehabilitation to stay in work for as long as they want to and can.
Marian Harkin, MEP, a great deal of discussion taking place in the European Parliament today about pain. Why is it so important to you to be a part of the Societal Impact of Pain Symposium?
Well, the topic we discussed today was chronic pain, a symptom or a disease. And when you look at the figures, roughly 100 million Europeans suffer from one kind of chronic pain or another. Now that makes it a European issue. That makes it an issue that all MEPs needs to focus on. So I have been involved from the very beginning with the Societal Impact of Pain, with the platform, with Pain Alliance Europe, etc. And I think part of the reason for that is that very often, chronic pain is different to ordinary pain, if you like, because somebody made the distinction today, the difference between pain that hurts, which is what we call normal pain, but pain that changes you. That's chronic pain. It changes your life. It changes even how you think. The brain changes. But it also causes significant problems for people, let's say, even in their close relationships. People sometimes wonder, are they imagining it? Is it in their head? They look fine. Are they malingering at work? There's a lot of stigma associated with it. There are a lot of different issues that people who have chronic pain suffer from apart from the pain itself. And one of the, I suppose, main points that arose from today's conference was the need for greater awareness among healthcare professionals, particularly GPs, because they're the first port of call for most people. So that if you look at the curricula, for example, for general practitioners, it barely mentions pain in most countries. So it needs to be developed as a section on its own. We had an Italian colleague today talking about the fact that they now have a diploma in pain management in Italy. In fact, one of my colleagues, John, informed me, I wasn't aware of this, we've had that in Ireland for the last 8 years. So progress is being made, but really today was about concentrating on the healthcare professionals, those who who are in the first line for treating patients who suffer from chronic pain. As I said, anything that's not visible or anything that's invisible always creates a difficulty. So therefore, we need to be particularly aware of it, and we need to look at many different ways of how we can approach pain management. Empowerment of patients is also a very important part of it.
Professor Bart Morlion, you represent the European Pain Federation. The symposium concerning pain has been taking place in the European Parliament today. How well do you think it's going?
We have a very good initiative today here within the European Parliament with a lot of stakeholders, and we had very interesting discussions about issues in pain, because pain is a very important issue within Europe. If you look at chronic pain, almost 1 in 5 and even up to 1 in 4 people in Europe are suffering from chronic pain. And national healthcare systems do not pay enough attention to this. So we hope to raise the awareness by our Societal Impact of Pain initiative, and by getting into discussion with different stakeholders, we can formulate quite clear recommendations for policymakers. It should be clear that if you address pain in a better way and in a good medical way, that you can also avoid a lot of costs. For instance, we had a discussion this afternoon about the reintegration of pain patients within the economic system. And it has been shown that if you can adapt and promote the reintegration of chronic pain patients, it can save a lot of money for the society. So it's not only helping the patient individually, but it brings also something for the economic system, and that's the point where we want to raise awareness with the politicians here in Brussels.
You say that policymakers aren't paying enough attention to chronic pain. Why do you think that is?
One of the reasons that not enough attention is paid to chronic pain is that it doesn't appear in registries, and if you look at data, there are not many good data available. People in the national healthcare registries, everybody knows exactly how much cancer there's going on, how much cardiac disease, but nobody has the exact numbers on chronic pain. And so one of the first things we need is to get pain as a healthcare indicator, quality indicator within the national healthcare systems. And although this is an obligation of the national EU member states, we hope that Europe can help to create a framework in promoting the attention to chronic pain.